then 4 weeks later, no, nothing's changed. And I got to tell you, one of the things that I realized it once you and I got together and once you and I really became close and I started to understand function health and really deep diving is just this idea of doctors really not only writing a prescription for what they're sensing and what our symptoms are, but also I think just having the aperture to go, well, let's take a look and go deeper. And the challenging thing for me was their very consistent declaration of this is what you have.
Yeah.
And you realize, and as someone who,
and you're stuck with it.
And you're stuck with it. But then if you don't know,
yeah,
like I didn't know at that time, I would think, oh, this is what I have then. And I'm going to get treated by this particular pill or two. But, it's that declaration that I realized after you and I got together, that's the declaration that's one of the challenges out there.
Yeah.
That when you declare things like this without doing a deeper dive on the blood panel, without doing a stool test, you realize how antiquated at times that system and that kind of training can be.
Yeah, it's true. And we're not trained to be proactive. We're not trained to be preventive. We're not trained to look at the cause. And that's where medicine's changing. And you mentioned functional health. That's where you can get the deep dive on your body that it's hard to find other places. And we did that for you. And one of the things you called me about later was your heart. And you got a bit of a scare. You want to talk about what that was and how we ended up figuring out what was going on? Because I think it speaks to the importance of actually looking at your risk factors in a deep way that we did with you with Functional Health Panel.